What happens to your testosterone and sexual health? When you ignore hormone balance, did you know that only about 6% of erectile dysfunction, ED cases, are caused by pure hormonal problems? Yet testosterone is often treated like a miracle fix. What if I told you that testosterone therapy might not be the silver bullet you expect, and that your estrogen levels, lifestyle, and overall health play equally crucial roles? Before we dive in, hit that like, share, and subscribe button, and drop a comment about your experiences or questions about testosterone and sexual health. Let's get into it. Introduction: the testosterone myth and the complex reality of men's sexual health. Testosterone is often glorified in popular culture as the key to male vitality, libido, muscle mass, and sexual performance. Billboards, supplements, and media portray it as the fountain of youth hormone. However, real science paints a far more nuanced picture. In reality, isolated testosterone deficiency accounts for only a small fraction of erectile dysfunction cases. Other factors, like cardiovascular health, neurological function, psychological state, and yes, hormone balance beyond testosterone, are equally, if not more, important. Large clinical trials such as the testosterone trials, TE trial, and the Traverse trial have explored how testosterone replacement therapy, TRT, impacts sexual function. Results show that testosterone helps improve erectile function, mainly in men with clinically low testosterone and relatively few other health issues. However, in older men with multiple chronic conditions, TRT boosts sexual activity but does not significantly improve erections. Furthermore, testosterone's interaction with other hormones, particularly estrogen, is critical but often overlooked. Both too low and too high estrogen levels can impair sexual function and bone health, creating a delicate hormonal balance that must be respected. Before we get into the science and timelines, if you're finding this topic eye-opening, please like, share, and subscribe so you don't miss out on future insights. Also, share your thoughts below. Have you experienced hormonal issues or TRT? What surprised you the most? Part 1. The role of testosterone in sexual function and when therapy works, 0 to 6 months. Surprising fact: testosterone deficiency causes only about 6% of erectile dysfunction cases. Most men think low testosterone is the main reason for erectile dysfunction, but hormonal causes alone explain a minority of cases. Instead, ED often results from a complex interplay of vascular, neurological, psychological, and endocrine factors. Key studies. The TE trial demonstrated that testosterone therapy improved erections primarily in men with low testosterone, less than 300 nanograms per deciliter, and mild ED. The Traverse trial, involving older men with multiple health problems, found TRT increased sexual activity but not significantly erectile function. Who benefits most from testosterone therapy? Men with mild erectile dysfunction, men with very low testosterone levels, typically below 300 nanograms per deciliter, men with few comorbidities, no major cardiovascular or metabolic diseases. Testosterone works best as part of a combined approach, often alongside phosphodiesterase 5, PDE5 inhibitors like Viagra or Cialis. For men who previously did not respond to these drugs, adding testosterone can sometimes unlock better results. Personal insight. From clinical observations, testosterone therapy alone rarely fixes erectile dysfunction in complex cases. Men with lifestyle factors like obesity, poor sleep, and chronic stress often need a holistic approach to improve hormone balance and vascular health for real improvements. Scientific note on safety. Testosterone's effect on the prostate plateaus after a certain threshold. Raising T beyond normal does not increase prostate cancer risk. Cardiovascular risk data remain inconclusive, but most studies show no significant increase in heart attacks or strokes with proper TRT. If you're learning something new, please click like and share this video. Subscribe for updates on male health. Got questions or your own story? Comment below. Part 2. Lifestyle changes, weight loss, and their impact on testosterone, 6 to 12 months. Shocking statistic. Losing just 10% of your body weight can raise testosterone levels by approximately 85 nanograms per deciliter. Obesity is one of the strongest modifiable factors negatively affecting testosterone levels. Fat tissue converts testosterone into estrogen via an enzyme called aromatase, lowering circulating testosterone and raising estrogen, which can disrupt sexual function and energy. Losing 10% of body weight increases T by approximately 85 nanograms per deciliter. Losing 15% of body weight can boost testosterone by as much as 250 nanograms per deciliter. Tools to sustain weight loss and improve hormones. Bariatric surgery for severe obesity has been shown to cause long-term improvements in testosterone. Chubby and pure GLP-1 receptor agonists, like semaglutide, help reduce appetite and maintain weight loss. Treating sleep apnea is critical since disrupted sleep lowers testosterone production. Managing chronic stress, seen in military personnel with operator syndrome, prevents lasting testosterone decline. Why sleep and stress matter. Testosterone production peaks during sleep, especially in the second half of the night. Poor sleep quality or insufficient duration can significantly lower testosterone. Stress triggers cortisol, which suppresses testosterone synthesis and reduces libido. Chronic stress thus has a compounding negative effect. Expert insight optimizing testosterone, even in men with low normal levels, can improve cognitive function, muscle mass, and bone density. This is especially relevant for populations like soldiers, athletes, and aging men. Before we continue, smash that like button, share this info with friends or family, and subscribe for science-backed health tips. Got personal experiences with weight loss or stress management affecting your hormones? Let us know in the comments. Part 3. The importance of estrogen balance in men's sexual health and bone density. 12 to 18 months, eye-opening. Fact: men with estradiol, estrogen, levels between 15 to 25 picograms per milliliter show significantly better bone mineral density, reducing risks of osteopenia and osteoporosis. Many men and doctors overlook the critical role of estrogen in male health. Contrary to popular belief, estrogen is essential for libido, erectile function, and especially bone health. The inverted U effect of estrogen. Too low estrogen, less than 15 picograms per milliliter, risks bone loss and sexual dysfunction. Optimal range around 30 to 50 picograms per milliliter corresponds with better sexual function and libido. Too high estrogen can also negatively affect libido and cause side effects like gynecomastia. The danger of over-suppressing estrogen. Some men take aromatase inhibitors, like Arimidex, preemptively to lower estrogen during testosterone therapy. However, over-suppression can cause loss of libido, fatigue, and bone thinning. Clinical recommendations. Avoid shotgun prescriptions of aromatase inhibitors without measuring estrogen. Adjust dosage carefully, e.g., 0.25 to 0.5 milligrams per week, aiming to keep estradiol in the 30 to 50 picograms per milliliter range. Monitor bone density with DEXA scans if estrogen levels are very low, especially in men with low testosterone. Personal perspective: balancing estrogen is like walking a tightrope. Too low or too high disrupts sexual health and bone integrity. Many patients feel better when their estradiol is managed conservatively, not aggressively suppressed. If you're surprised by the role of estrogen in men's health, hit like, share, and subscribe. Share your experiences or questions on estrogen management in the comments. Part 4. Varicocele surgery and anabolic steroids. When is testosterone therapy enough? Varicocele repair. Limited benefits for testosterone improvement. Varicocele, enlarged veins in the scrotum, can cause pain, infertility, or testicular atrophy. Surgery is often recommended only for these symptoms. Surgery to increase testosterone alone, especially if expected gains are marginal, is generally not advised due to surgical risks. Careful evaluation is necessary before recommending varicocele repair solely for hormonal reasons. Anabolic steroid use, risks and realities. Many bodybuilders and athletes use anabolic steroids to enhance muscle mass and performance. These substances have varying anabolic, muscle-building, to androgenic, masculinizing effects. Some anabolic steroids are FDA approved for medical use, but off-label use for bodybuilding lacks long-term safety data. Side effects after stopping steroids can include muscle loss, sexual dysfunction, and hormone imbalances. Some patients require higher testosterone doses post-steroids to feel symptom relief due to receptor changes. Responsible testosterone therapy focuses on symptoms, not just numbers. The goal of TRT should be to improve quality of life, libido, energy, mood, muscle strength, and bone health, not just to hit a target testosterone number. Before we wrap up, please like, share, and subscribe if you found this insightful. Have questions or stories about anabolic steroids or varicocele surgery? Share below. Conclusion: testosterone therapy is not a one-size-fits-all. Balance and individualized care. Our key men's sexual health and hormone balance is complex. Testosterone deficiency alone rarely explains erectile dysfunction, and testosterone therapy is most effective when combined with lifestyle improvements and sometimes other medications. Estrogen plays a surprisingly crucial role in libido and bone health. Over-suppressing estrogen with aromatase inhibitors can cause more harm than good, highlighting the importance of careful hormone monitoring. Weight loss, stress management, sleep quality, and addressing comorbidities are essential components in improving testosterone naturally or alongside therapy. In the end, individualized treatment tailored to symptoms, hormone levels, and overall health status provides the best outcomes for men seeking better sexual function and vitality. If you want more science-based health advice, hit that like, share, and subscribe button now. Leave your thoughts or questions below. I'm curious to hear your experiences with hormone therapy or natural approaches to boosting testosterone.